Welcome to the Stop Suicides Suicide Prevention Policy Introduction. Preventing suicide and promoting positive mental health is really important to us. This animation brings to life our strong commitment to suicide prevention. We know the importance of open communication, early intervention, and seeking professional help. We aim to create a supportive and understanding environment where individuals feel comfortable discussing mental health concerns. This includes encouraging staff and volunteers to support and spot signs of poor mental health or signs that someone might want to take their own life. This is important to remember in the daily interactions between your colleagues, as well as service users or beneficiaries. What to do if you think someone under the age of 18 is at risk of suicide. If you feel that someone under the age of 18 is at risk of suicide, contact your designated safeguarding lead or follow the child safeguarding policy in your organisation. What to do if you think someone over the age of 18 is at risk of suicide. Firstly, never dismiss or minimise concerns about suicide. If you've noticed a change in behaviour or verbal clues that might indicate that the person is feeling suicidal, you're demonstrating that you care. The next step is to take a calm and supportive approach, to reassure the person and encourage them to feel safe. In a private space away from others, ask the person if they feel suicidal in a sensitive but direct way. Examples are, have you had thoughts about ending your life? Or, are you thinking about suicide? The important part of this conversation is to avoid language that could be misinterpreted. Asking directly, without judgment, will help inform the next steps. Provide space in the conversation for the person you're concerned about to express their thoughts and feelings, whilst actively listening to what they have to say. During the conversation, ask whether the person is at imminent risk of suicide by asking direct questions. For example, have you made the decision to end your life? Or, do you have a plan for ending your life? If the risk of suicide is immediate and someone is in imminent danger of ending their own life, i.e. if the person is in crisis, call 999 and inform their manager and a member of the senior leadership team at the safest opportunity. Stay with the person until professional help arrives. If there is no immediate risk to life, support the person to complete or signpost to a safety plan tool from stayingsafe.net and discuss how they'll share their feelings with their manager. You could ask whether they want to do this together. It's important to let the person know that confidentiality never applies to suicide and that you want to support the person in getting help. This could mean signposting someone to a service such as their doctor. Samaritans are a free phone line that provides support 24/7 every day of the year and can be contacted on 116 123. You can also find more signposting support services in your suicide prevention policy.